The next question is, well, I'm worried about a mole. What should I do? Well, that's where we come in. So skin cancer clinics like White Horse Skin Cancer Clinic, what we do is we offer you a service where you come in and either do a spot check, where we just check 1 or 2 or 3 spots to make sure they're looking okay, and we have a special microscope that helps aid our assessment of the mole. Or we can do a whole body check, doing the same way. And then the top tier thing that we would offer would be a total body photography, or what people commonly know as mole mapping. And mole mapping is really powerful because rather than me relying on my memory and your memory to see whether a mole has changed over time, we've got photos of all your moles that we just repeat year on year, so that not just our memory, but the computer algorithm, plus or minus AI, can then compare mole with mole to see if anything has changed over time. Now, how frequently should I get a skin check? Well, if you're low risk, probably once a year is enough. But if you're high risk, then we would often ask for you to consider up to every 6 months. And if you had a recent melanoma diagnosis, then that would change things. And so your specialist, your oncologist, your surgeon, or we will give you advice in terms of how frequently we need to follow you up. If you do have a suspicious spot, what happens? Well, when you come in, we're going to check it, see if it's suspicious or not, and depending on what it looks like, we might take a sample, what we call a biopsy, and that will get sent off for checking under a microscope by a pathologist. If it comes back as something nasty like a melanoma, then we will book you in for an operation. Melanomas are never left there unless by the guidance of an oncologist or specialist. And depending on the size, the depth, and what else is involved, often you will need to see an oncologist as well, maybe a melanoma surgeon. And if it's something that's manageable, then we can deal with it here at the Skin Cancer Clinic, where we just cut it out for you. But definitely, once you've had a melanoma, you would definitely be wanting to have yourself checked on a regular basis, at least annually, if not more frequently. So if you've got any questions, feel free to reach out to us at the White Horse Skin Cancer Clinic. We're just a phone call away. You can book to see us via a online booking through our website. You can also speak to a receptionist to clarify what needs to be done. And obviously, you can just come in for a check, and we're more than happy to chat while we're chatting for you. Hope that was helpful. And again, stay safe. Remember that there's many benefits for the sun, but you can also have too much of a good thing. So we definitely would encourage you to slip, slop, slap, and stay safe in the dangerous parts of the day, and just to avoid being sunburnt. And for those who are at increased risk, I would definitely encourage you to come in to get checked out.